Hello, my name is Ashley Marshall. Today I'm going to show you how to do a manual blood pressure. There are many ways to take a blood pressure. There's the digital kind where it's attached to a battery and your job is just to put the cuff on, and there's no listening or really anything else you have to do besides read the little digital screen. And normal blood pressure is 120/80. 120/80, that means millimeters of mercury. That is the unit we use with blood pressure. So that is our goal. 120/80 is the range. That's the normal range. It's very important, blood pressure. Blood pressure is the force against our arterial walls. I have a little diagram here. I don't know if you can see, but we have red blood cells in our arms, or all parts of our body, but I just chose the arm because that's what we're gonna do today. We can take the blood pressure on our arm, calf, on our wrist. There's many ways, or body parts you can take a blood pressure on too, which is nice, especially if somebody has like swelling in their arm. That would be a case where we would put it down here or on their calf. So yeah, we are aiming for 120/80 millimeters of mercury. And on the manual blood pressure, the dial, I'm going to show you, there are increments of 2. So it goes 120, 100, but every other line is 2. So we're not going to get like 123/87. Like, that's impossible. On the ones with the batteries, that is possible just because that's kind of exact. But on this one, that's not possible because those numbers aren't on it. It's just even numbers that go by 2. So like I said, this is the dial that we read. Oops. It's hard to reverse it on the camera. This is the valve that we pump up, and this is the cuff that goes on the arm. And I'm going to show you, doing this all close up because I'm going to be far away in a second. But this is the index. This is the mark. This is going to be kind of your base. It has to be 2 inches from your brachial artery. So that's like right here. So it's gonna be placed here, and then it's gonna wrap around. We gotta make sure that this is lined up. And this whole thing is called a sphygmomanometer, which is a big word. I had to learn how to spell it in my CNA class. I'm a CNA. I've been a CNA for about 1.5 years, so I am confident in this skill. And it did take a while for me to be confident because it is kind of overwhelming, like taking someone's blood pressure and being in a hospital and doing all that. Like, that's pretty intimidating, but now I'm comfortable and I'm going to share it with you. I have my friend Morgan here, who is going to be my patient. In a more professional setting, I would have washed my hands, put on gloves, and wiped down my equipment with an alcohol swab because chances are it was used by another person before. So I'm going to start by, pretend I have gloves on. I'm going to start by, like I said before, putting that index on her arm, on her brachial artery, 2 inches above, and make sure that arrow was in her front, and I'm going to wrap it around. Make sure it's on there and make sure it fits the patient, because if the patient, or if I say patient, if you're doing this like to your mom or your sister or cousin, whatever, it needs to fit, and it's not going to give a precise reading if it does not fit. So we got to make sure it fits. I'm going to clip this dial on the cuff, just so, because my hands are going to be full of the stethoscope and the dial. I put these on. This is a stethoscope. This is the part that's going to go on her arm, and this is the part that I'm going to listen. Put these on, and I'm going to put the head of the stethoscope right on her brachial artery, and I'm going to listen for that pulse. Once I find that, I can begin pumping up the cuff There it is. Found it. So once you found the pulse, you're going to pump it up to about 20 millimeters of mercury. If they are a person with high blood pressure, that would be like 160. So you're going to pump it up to 160 millimeters of mercury. If they have they usually have a normal blood pressure, it's going to be 140. So you're going to pump it to 140. So I'm going to pump it to 140. And then I'm going to stop at 140 and I'm going to slowly release. And we're listening for the first beat. And at the first beat is going to be our top number. Remember how I said it's going to be around 120? I'm listening for that first beat. Oh, so at 110 was the first beat. So our top number, our systolic we call it, is, okay, yep. And then I heard the second beat and it's slowly going down. So the second beat, the blood pressure is 74. So her blood pressure is 110 over 74. I heard a beat at 110 and another beat, the last beat, at 74. So that is her blood pressure, which is normal, and that's good. So then we're going to take our stethoscope out. Take this, make sure you deflate it all the way before taking it out. And then you're going to document and record the blood pressure. And like I said before, the normal blood pressure is 120 over 80. So the hypertensive range is about like 130. But high blood pressure does run in families and is genetic. So it's not a concern all the time. So don't get too concerned. But thank you for staying here and listening to my speech and watching my demonstration. Thank you.